So how do you think U.S. healthcare is doing? It was just a few years ago, another decade or 15 years ago, that we did a study, the World Health Organization did, that is, showing that the U.S. is ranked number 37 in the world in the overall quality of healthcare. That really shocked a lot of us. We couldn't believe it. With all the technology we have and the high-powered research and the stuff we're doing with the human genome and stem cells, etc., you'd think that would be the very best. And a lot of the reason why we weren't the best is because of healthcare disparities. But there's also the problem of what are people actually getting from the healthcare system? We've got a sick care system and we're looking after trying to treat disease rather than a healthcare system where we're trying to keep people from getting sick in the first place, which is the best. Plus, we're the only industrialized country in the world of the 19 industrialized countries that doesn't have universal health care. Well, there was a study that was done in the Journal of the American Medical Association in June or July of 2013 that showed that the U.S. is doing a little better than it was some time ago. We're living about 3 years longer. But when we compared this, as was done by the Institute for Health Metrics and Evaluation at the University of Washington, they found that we were not doing as well as our other industrialized countries are. They're doing better and leaving us farther in the dust, even though they're spending about half or less what we do every year in healthcare. And what they did is they looked at 291 diseases, 67 risk factors, and what they found, and that was in 34 high-income countries, and what they decided is that we are losing ground in every health category that there is over the past 20 years. In particular, we've had problems with psychiatric disorders, substance abuse, and all kinds of pain disabilities from the back and the neck with disc problems. Now, what's that reflecting? What's happening in this country that's different? Are we more competitive? Are we more interested in dollars than we are service compared to the other countries? And that's not to say that they aren't too. And apparently that may be the case, because how else do you get these problems? Why do we have so much in the way of mental disorders? Why are we having so many traffic accidents? Are we too tired? And we lead in those, by the way. So there are lots of things that we need to take a look at when we're looking at healthcare and the quality of healthcare. When you look at the major disabilities, heart disease, cancer, stroke, diabetes, infections, we still have about the same ratios that we had years ago, and the order of what is causing death is the same. And the disabilities that we have that are related to risk factors have really to do with poor diet, smoking, obesity, high blood pressure. We're not doing much better with those either. So we have to find a way to take responsibility ourselves. And we're getting a little bit of help from Michelle Obama. She's actually the one that requested these studies be done. And now that they are reported and the results are in, we need to pay attention to some of the things like what she's doing with organic gardening and fruits and vegetables and promoting exercise, all the lifestyle things she's talking about. And she's calling together a convention of the top 50 or so mayors in the United States to talk about this problem. But I think really, even though the intentions may be good, we need a new system. And it's not like we want to throw Western medicine out. That would be silly. We're not going to do that. But what we could do is we could start thinking more in terms of what we have to do to make Americans healthy. And if we promote lifestyle medicine and just look at the simple things like diet, exercise, stress reduction, sleep, what we weigh, exposure to toxic and chemicals in the environment, and having a meaningful purpose in our life, we'll not only have better health, but we'll elevate the mood that we're in too, because we'll be healthier and we'll be living longer as well. So yes, America's healthcare needs a revision, and it needs it now. Hopefully, some of these factors will spur us as individuals to take more responsibility so that we can ensure our own health by taking the action we need that will get us on the right track.